Hi, welcome to another episode of Medicine Simplified. In this video, we will know about TNM staging of oral cancer. Please remember, this is an educational video for medical professionals and medical students. Staging of oral cancer can be done by TNM staging and STNMP staging. TNM staging is proposed and developed by French surgeon Perry Denoix between 1943 and 1952. Now it is updated by Union for International Cancer Control and American Joint Committee on Cancer. There are three main components of TNM staging. First one is T, tumor, which describes the size and depth of invasion of primary tumor. Second is N, node, which indicates if the cancer has spread to nearby lymph nodes and whether there is extranodal extension. Third one is M, metastasis, shows if the cancer has spread to distant parts of body. Coming to the tumor staging, TX stands for primary tumor cannot be assessed. T0, no evidence of primary tumor. TIS, carcinoma in situ. T1, tumor is 2 cm or less in greatest dimension. T2, tumor is more than 2 cm but not more than 4 cm in dimension. T3, tumor is more than 4 cm in greatest dimension. T4 is subdivided into T4A and T4B. T4A is further divided into lip and oral cavity. T4A lip. Tumor invades through cortical bone, inferior alveolar nerve, floor of mouth or skin. T4A oral cavity. Tumor invades through cortical bone into deep extrinsic muscles of tongue, which are genoglossus, hyoglossus, palatoglossus, and styloglossus. Even further into maxillary sinus or skin of face. T4B, lip and oral cavity. Tumor invades masticatory spaces, pterygoid plates, or skull base, which can also encase internal carotid artery. Coming to lymph node staging, NX stands for regional lymph nodes cannot be assessed. N0, no regional lymph node metastasis. N1, metastasis in single ipsilateral lymph node, which is 3 cm or less in greatest dimension. Ipsilateral means same side. Contralateral means opposite side of body. N2, metastasis as specified in N2A, 2B and 2C. N2A, metastasis in single ipsilateral lymph node more than 3 cm but not more than 6 cm. N2B is metastasis in multiple ipsilateral lymph nodes, none more than 6 cm in greatest dimension. N2C, metastasis in bilateral or contralateral, that means opposite side of body. Lymph nodes none more than 6 centimeters in greatest dimension. Last is N3, metastasis in lymph node more than 6 centimeter in greatest dimension. Next is metastasis. M0 indicates no distant metastasis. M1, distant metastasis. Coming to the TNM staging. Stage 1 indicates T1, N0 and M0. T1 is tumor which is less than 2 centimeters and there is no regional lymph node and metastasis. Stage 2, greater than 2 centimeters but less than 4 centimeters, that is T2, N0 and M0. Stage 3, which is T3, N0, M0, or T1, N1, MO, or T2, N1, MO, or T3, N1, MO. MO is no metastasis. N1 is metastasis in single ipsilateral lymph node, which is greater than 3 centimeters in dimension. Coming to the T3, we know that tumor is greater than 4 centimeters and tumor having extra parenchymal extension. Coming to the stage 4A. T4A is which involves lip or oral cavity. Stage 4A can indicate T4A, N0, M0 or N1, M0, N2 or M0. Next is stage 4B. T4B, which involves both lip and oral cavity, any N, M0 or any T staging. Next is N3, more than 6 centimeters, which can be contralateral, and M0. There is another stage 4C, that is any T, any N and M1, distant metastasis seen. If you like this video, please subscribe to our channel. Thank you.